The morning of your surgery, you will come to the East Building at Gundersen. You might have to come in very early in the morning, so you can even come in your pajamas if you want to. You can't have anything to eat or drink the morning before surgery, so make sure you have a snack before bed. When you get to the East Building, you will take the elevator up to the Outpatient Surgery Center on the 5th floor. You will have to check in at the desk to tell them you are here for surgery. You can wait in the children's waiting area or the lobby until it's your turn. When they are ready for you, someone will come and get you and your parent or a caregiver from the waiting room. You will stand on the scale to check your height and weight. Then you will go to the room where you will get ready for surgery. You will get some special pajamas to wear during your surgery. You will also get some slippers to wear. You can take the slippers home with you after your surgery. You will get 2 bracelets to wear. The white one says your name on it, and the other one tells if you are allergic to any medicines. They will check your temperature to make sure that you are healthy for surgery. They use a thermometer to gently swipe across your forehead. The nurse will put a pulse oximeter on your finger. A pulse oximeter is a little clip or sticker that shows the nurse how well you are breathing. A red light glows from it and it does not hurt. Your doctor will come in to see you before surgery to see if you or your parent or caregiver have any questions before your surgery. The anesthesiologist will come to see you before your surgery. This is the doctor who helps get people to sleep for surgery. They will ask you and your parent or caregiver some questions. They might listen to your chest and have you open your mouth really wide. They also like to know if you have any loose teeth. The child life specialists will come to see you before surgery. They help teach kids what's going to happen and set a plan to make things as easy as possible for your surgery. Before your surgery, the nurse might give you some medicine to drink. This medicine can make you kind of sleepy and relaxed. Some kids even get a little silly. When they are ready, the people from the operating room will come to get you for your surgery. Most of the time, your parent or caregiver can come with you to the operating room while you go to sleep. If they aren't able to come, they will wait for you in the waiting room the whole time. There will be lots of people with you in the operating room, and they are all there to help take care of you. They all wear the blue scrubs and hats and masks to keep it really clean in there. You'll have to move off your hospital bed onto the operating table. You will see big, white, bright lights above you. You will also get a nice warm blanket. A seat belt will be placed across your stomach so that you will stay nice and safe on the operating table. A pulse oximeter sticker will be placed on your finger to show how you are breathing during surgery. Some stickers will be placed on your chest and your sides so they can watch how your heart is beating during surgery. A blood pressure cuff will be placed on your arm. This gives your arm a tight hug and shows how your heart is working. When everything is in place and it's time for your surgery, a soft, clear mask will be placed over your mouth and nose. Some special air will blow through this to help you go to sleep for your surgery. Here are some things to know about going to sleep. The mask does not hurt, but it does smell a little bit different. You will keep getting special medicine so you won't feel anything during your surgery. They give you just the right amount of medicine so that you are comfortable in sleeping. When your surgery is done, you will stop getting that sleeping medicine, and that is when you will wake up. When the doctor is done and your surgery is over, you'll go to the recovery room. This is the name for the room where people wake up after surgery. There will be a funnel blowing some cool, wet air in front of your face. The nurses in the recovery room will take care of you. They will take your temperature and you will still have that sticker on your finger. You might hear some beeping next to you, and that just tells the nurse how you're doing. You will also have an IV in your hand when you wake up. Most of the time, they put this in during surgery, so you won't feel it go in. An IV is a small straw or tube that goes into a vein, the small blue lines, in your hand or arm. It is hooked up to a bag of special water. You will have this IV until you go home, and it can be used to give you medicines. It also gives you a big drink of water right through your hand. When you wake up in the recovery room, your parent or a caregiver can come and lay in the bed with you there. Once you are awake enough, the nurses will take you back to the room where you started. The rest of your family can come see you there. Before you go home, you have to be able to drink some water or juice. You can even have popsicles to eat. You will stay in this room until the nurses think you are ready to go home, so you can watch a movie while you rest. When you are all ready to go home, your IV will be taken out and you can get back to your own clothes or pajamas. You will get a ride in a wheelchair down the elevator and to your car. You will probably be tired for the rest of the day after surgery. When you get home, you should do quiet activities like watch TV or play quiet games. After a few days, you will start to feel better. Some kids have to get an IV before surgery to help give them medicines and fluids, or special water. An IV is a small straw or tube that goes into the veins, or little blue lines, in your hand or arm. The nurse will wrap your hand up in a warm, wet towel and put it in a bag. This helps them find your veins easier because they puff up when they get warm. Next, the nurse will put a blue rubber band around your arm. It might be a little tight, but it will come off as soon as possible. This also helps to see the veins better. Then she will clean your hand with a special cleaner. It will feel cool and wet. You can talk with your nurse about options for numbing your skin before the IV. Next, the IV will be placed in your hand or arm. Since it is just like a little straw, you can bend and move your hand or arm once it's in place and it will move right with you. Some kids say they don't even feel the IV going in. Some kids say it feels like a pinch, or like someone is pushing on their hand. The nurse will tape and wrap it up so it won't fall out. It shouldn't bother you once it's in place. If you get an IV before surgery, they can use special medicine through the IV to help you get to sleep instead of having you breathe the special air.